My name is Sendel Thompson. I am an LPN to BSN distance learning student at Indiana State University, and this is a presentation on bladder prolapse, the risks, signs and symptoms, and treatment options. Please pause the video and complete the pre and post test linked underneath this video in the description area to assess your current level of knowledge prior to proceeding with this presentation. Learning objectives. Risks of bladder prolapse, the signs and symptoms of bladder prolapse, and treatment options for bladder prolapse. Bladder prolapse, also called cystocele, occurs due to weakening of the muscles and tissues that support the organs within the pelvic activity. Again, this can also be called cystocele or pelvic organ prolapse. The National Institute of Diabetes and Digestive and Kidney Diseases report that experts estimate nearly half of women who have given vaginal birth have some degree of pelvic organ prolapse. Risk factors. Increased risk factors are 60 to 69-year-old women. Ethnicity can also increase risk. Hispanic and Caucasian women. Family history of bladder prolapse. Individuals who have a chronic cough, which increases abdominal pressure. Also, if you have constipation, which also increases abdominal pressure and causes pressure on the pelvic organs. Obesity, so an elevated BMI, can cause pressure within the abdomen, can also increase your risk of bladder prolapse. Heavy lifting, vaginal childbirth, and the more vaginal childbirths you have, the greater your risk of developing bladder prolapse. Being perimenopausal, so this is the time frame when menstruation starts to cease or has ceased for you. Having a hysterectomy, previous prolapse surgery. Signs and symptoms of bladder prolapse. Vaginal bulge. So oftentimes women will feel a bulge, something coming actually from their vagina. Any sort of pressure in the pelvic area. Urine leakage. This can be just leaking in general. It can be not being able to make it to the bathroom in time and urine leaking, or urine leaking when you cough, sneeze, laugh, that sort of thing. Having difficulty going to the bathroom can also be a sign. So if you have difficulty starting your urine stream or your urine stream is weak, those can be signs of bladder prolapse because the organs themselves can occlude your urethra, which is where you urinate. And if those organs are pushing down the urethra, you're going to have a harder time getting your urine to come out, which produces a weaker stream and or not even be able to start a urine stream. Can also have difficulty with bowel movements. With the organs prolapsed, they can apply pressure to your intestines and cause difficulty with actually having a bowel movement as well. So it's not just urine related, it can also be related to your bowels and cause symptoms with your bowels. Vaginal discharge can be a sign. This can be due to irritation, can be due to infection because of the organs coming out of the vaginal cavity. You can also have bleeding. A frequent or urgent need to urinate can also be a sign of bladder prolapse. Treatment options. Some of the treatment options are as follows. Observation. So treatment is not always required for bladder prolapse. Sometimes you can do lifestyle modifications. If you're smoking, quitting smoking, making sure you're not doing any heavy lifting, increasing that abdominal pressure. Again, with the constipation, that also increases abdominal pressure. So making sure you're eating enough fiber, staying well hydrated, you're moving around enough to keep your intestines flowing, things like that. You can also do pelvic floor muscle training. You've probably heard of Kegels before. That's what this is. It can help improve symptoms like the urinary leakage. You want to do Kegel exercises. If you're going to do them, you're going to do about 45 to 60 a day. While this does not reverse the actual organ prolapse, it does improve the symptoms. So the urinary symptoms that often comes with bladder prolapse, you will experience improvement in those symptoms. Pessary devices are also another option. These are temporary devices that are placed in the vaginal cavity to help support the organs inside the vaginal cavity. Erosion can occur with pessary devices. They need to be inserted and removed regularly, and you should wait no longer than a month to insert and remove these. And that's typically more recommended for individuals who have a decreased range of motion in their hands, or individuals who have memory issues, dementia, things like that. Those individuals may require going into a medical facility for the pessary device to be inserted and removed. So that's where your weekly, bi-weekly, monthly intervals are going to be seen more frequently, not so much if you can actually do it yourself at home. Pessary devices do increase risk of infection. Signs of infection would be discharge, bleeding, irritation, odor. The increased risk of infection comes with not being changed frequently enough, not maintaining good hygiene, making sure your hands are clean, making sure the pessary device doesn't touch anything that has bacteria on it before inserting it. Also, because the pessary can cause irritation, it can cause tissue breakdown, which is where you can also get an increased risk of infection. The last option is surgery. Surgery is generally recommended for individuals who would like to maintain sexual function. So if you want a sexual relationship and you have bladder prolapse, typically surgery is going to be the best option for you. One of those surgeries could be hysterectomy. Another one would be suspension of the organs in your pelvic cavity. Native tissue is the best way to do this. Mesh is an option. The problem with mesh is there have been some complications associated with the use of mesh. When mesh is used, the tissues in the vaginal cavity get inflamed and they create scar tissue around that mesh. And when that happens, that scar tissue gets hard. If there are issues with the mesh cannot really be removed in its entirety because it becomes part of the tissues in the vaginal cavity. So again, definitely want to make sure you do your research thoroughly, use caution prior to deciding to move on with surgery with mesh. The best option would be native tissue, and if surgery is recommended and the provider recommends mesh, I would just suggest getting a second opinion to ensure that you are doing what is best for you. Please complete the pre and post test again. It's linked under this video in the description area to assess your level of knowledge upon completion of this presentation. There is also a brochure to accompany this video that's attached under the pre and post test in the description area under the video.